Yes.
There is one correction I need to make. Can I ask that NHB T0001065 be put back up on screen, please? So these were the minutes of the Consultants Advisors meeting on the 27th of November 1981. It's been drawn to my attention over the break that what I had thought was an attendance list, and apologies, is in fact just the new attendees and the apologies. So that's 5 new joiners and 3 apologies. We don't have a complete list of the advisors who were on the panel and at attendance in that meeting other than the new joiners. So just to correct what I said there, and to add that what we do have is evidence, the evidence of Dr. Walford, who told the inquiry in the section of her witness statement dealing with her time as a principal medical officer in the medical SEB division from September 1979 onwards in DHSS. She said the CMOs were each advised by an external expert who was designated the consultant advisor in blood transfusion. Such consultant advisor appointments existed for only a few other specialties. That evidence is set out in paragraph 22 of the written presentation for those following at home. So what we know, or what we have, is Dr. Walford's evidence that there were a few other specialties in addition to blood transfusion as at the beginning of the 1980s. And we have the evidence we looked at of Donald Acheson's statement to the BSE inquiry in 1998 that by that time there were over 80 consultant advisors. But what we don't have is a complete list of the specialties as at the early 1980s. So I apologise for giving that impression looking at this document and correct the record in that respect.
Well, it leads to this question, I think, which is, do we know if there was any consultant, specifically in public health, as it might be thought, such as a communicable disease specialist, or for that matter, a public health specialist?
That's something I don't know now, but we will look into.
Thank you.
So before the break, we had looked at a briefing from Dr. Smithies during October of 1984. And the response from the CMO. The next document, going back to that part of the narrative, is at DHSC 0002249_034. And this is a further minute which Dr. Smithies submitted on the 20th of November 1984 for the attention of the CMO. In the first paragraph, she updated him that the Central Blood Laboratory Authority had announced the day before that they planned to heat treat all Factor VIII manufactured there from April 1985 onwards. And in the last paragraph that's up on screen, she noted that the use of heat-treated Factor VIII, sorry, if we could just zoom out. Yes, it is that paragraph, sorry. That the pilot trials had shown that the heat treatment did not inactivate non-A, non-B hepatitis, and that there would be a programme of intended introduction of heat-treated Factor VIII in order to make that available to haemophiliac patients in the UK, but there wasn't a time frame given at that time. If we next go then to the annual report for 1983, which is at DHSC 0007005. And could we look at page 16, please, which is the last page of the introduction section. You'll see said that it's signed by Donald Aitchison, but he acknowledges in the paragraph above that throughout 1983 Sir Henry Yellowlees was in post, and that the report describes the events that took place during his term of office, and he had helped in the preparation of the report. So this report can be seen to some extent as a joint production between the two of them. Could we go back to page 13 in this document, please? So we can see that within the introduction section there is a part on communicable diseases, and the second paragraph there on the page refers to AIDS. So we can see that it's being foregrounded as an issue by the 1983 report, which we know the introduction to which was written in December 1984. The same caveats apply as to we don't know exactly when all parts of the report were drafted. And then if we go to page 54 within the document, please, within the communicable diseases chapter, so this is the equivalent chapter we went to for the previous year's report, and we can there see that there is now a page and a half devoted to AIDS. Can we look at the penultimate paragraph on that page, please? It refers to AIDS in the UK blood donor and explains that a leaflet had been distributed in blood transfusion centres and sexually transmitted disease clinics. And then the bottom paragraph on that page is AIDS in the general public. And what's said there is that expert opinion suggests that there is no risk of contracting AIDS as a result of casual or social contact with AIDS patients, e.g. on public transport, and then at the top of the next page, restaurants or in private dwellings. The spread of AIDS appears to require intimate contact. And the relevance of that thematically, we'll see some other documents as well, is that Sir Donald Aitchison, as part of his role, appears to have seen part of his role as addressing misinformation and stigma. So as well as providing information about AIDS, there are places in the documents where he corrects misinformation. And so that is an element of the CMO role, which also is developed thematically through the presentation.
The purpose of the document, the report on the health of the nation, who was it intended should be the readership?
That's a really good question. It was a public document, so it wasn't just for doctors. Anybody could read it.
The reason I ask is because of the language. If you look at the very top of that page and the sentence, the spread of AIDS appears to require intimate contact. There may be a number of people who would understand that to mean sex. Others might have a different idea about what intimate contact might be. And it may not transmit the meaning which I take to be sex. Am I right?
I would assume you are right, looking at the page.
But
yes.
Intimate contact could be other contacts. Is kissing intimate contact, for instance?
I don't know if I'm qualified to opine.
It's a rhetorical question, really, as to the quality of the language in transmitting its information to an audience who will have different ideas.
The imprecision of language is something that comes back later as well. When we're looking at the later public education campaigns, we'll come to a part of Sir Donald Aitchison's autobiography where he talks about the difficulty he had in persuading ministers, including the Prime Minister, Margaret Thatcher, to use blunt enough language that people would know what they were talking about, because there is a tendency to use euphemism because it's politer. But the problem is, if people don't understand what that really means, then the public health message, and in particular people understanding what they can and cannot do, is lost or muddied. So I hadn't picked up on that when preparing the presentation, but I think it is also a theme that gradually develops in that the language used becomes more specific as that problem is realised and those conversations are had.
I mean, it might be thought important that a public health message, if this is one, is put in the most obvious and plain language. But
yeah.
There we are. That's a comment rather than anything else.
So in terms of public statements, the next document we're going to go to is BART 0000814, which is a press release of the 20th, well, this is the front page, enclosing, a copy of the Chief Medical Officer's press release on the 20th of December 1984. And the context was it followed media inquiries after a report in the Guardian newspaper on that date about 2 cases of suspected or alleged AIDS transmission through blood donation. And if we could go to the second page of the document where the press release is set out, we can see from the second paragraph onwards, there is a quote from Sir Donald Aitchison. He says that donations of blood and blood plasma have been given by a person who was subsequently admitted to hospital in Wessex in October and later diagnosed as suffering from AIDS, and that his donations of both blood and blood plasma have been traced and all possible remedial action taken. And then if we skip the next 2 paragraphs and focus on page 3, at the top of page 3, please. He goes on to say that none of the recipients of the blood donations or the factor VIII made from this donor's blood plasma has shown any clinical signs of developing AIDS, and continues that he would like to stress that anyone who is advised to have a blood transfusion or who has been given a transfusion should not worry, because the risk of getting contaminated blood is extremely small. Even if a person is proved positive in the antibody screening test, it does not mean that he or she will develop AIDS. Only a very small proportion of people with positive results go on to show symptoms. And then under the next 3 subheadings, the press statement noted measures that were being taken, including that revised leaflet for high-risk groups, the development of a screening test, and heat treatment, which it was hoped would be introduced from April of 1985. So this is an example of a public statement portraying a reassuring or somewhat reassuring message to the general public in relation to media concern about transmission of AIDS.
What's fascinating, perhaps, about this is that it refers to a case of ordinary blood transfusion given to 3 recipients to whom the disease may have been transmitted. But on the same day that the article was published in The Guardian to which this responds, the 20th of December, there was there not, a publication in the Yorkshire Post and for that matter elsewhere, talking about what people have come to know as the Edinburgh Cohort. And we've heard evidence that on the 19th of December, there was a meeting held by Professor Ludlam in order to tell people who had been affected by transmission of HIV to them that that was the case. That doesn't feature in this at all.
No, and I hadn't realised the context. You're quite right. This is a separate or parallel conversation that seems to be taking place without any reference to the Edinburgh Cohort.
So, do we have any sense as to whether and when that knowledge must have reached, as one supposes it ought to have done, to the Chief Medical Officer of the UK, or at least of England, or was it perhaps because it was Scotland that it didn't feature? But it's still relevant, one would have thought, to his expression of how the risk of getting contaminated blood is extremely small.
Yes, I haven't seen a document that briefs him on that issue. We will check and see if there's anything else that could help illuminate that point.
Thank you.
The next internal briefing document we have is at DHSC 0001693, and it is another briefing from Dr. Smithies, dated the 31st of December 1984, setting out the current position with regard to AIDS as requested by the Chief Medical Officer. At page 2 of the document, we can see the position paper itself, AIDS and its prevention in the United Kingdom. She reports that cases in the UK since 1981 to the end of November 1984 had reached 102. 44 people had died. She noted that there were 3 cases in people with haemophilia A, of whom 2 had died, and there's an annex setting out the statistics. Under causative agent, we can see at the bottom of the screen now, it was now accepted that the isolates of retrovirus HTLV3 were probably the causative agent of AIDS, either singly or in association with other unknown agents. And could we look at the penultimate paragraph on the page? It's noted in that indented citation that the incidence of HLTV3 seropositivity in 800 haemophiliacs screened in the UK was about 35%. And in patients with severe haemophilia, it was 75%. Could we go to page 3?
Sorry, where did we get the 75%?
Sorry, I've got it in my note as this page, but I just want to check over at page 3. I might have got myself out of order.
Doesn't seem to be there.
Could we go to page 7, please? Yes, here we go. Sorry, I'd mistranscribed the reference. So it's in this section, AIDS and blood products. The case numbers are given, and then about halfway down the paragraph is the statistic that I cited. 800 haemophiliacs had been tested, and the incidence was 35%, and with severe haemophilia it was 75%. Could we go back to page 4, please, and look at section 6, blood transfusion and AIDS? Dr. Smithies noted that although no one had yet contracted AIDS from a blood transfusion, in the UK, there were 3 seropositive recipients of blood from a donor in Wessex, and the donor had AIDS, and that there may well be other donors who were unaware that they were infected And then in the final paragraph of that page, please, she wrote 4 lines down that the only way to prevent further infections was to institute screening of all blood donations. And if we could go to the next page, please, page 5, and look at section 7. We can see that the MBTS working group on AIDS, a panel of expert advisors, had agreed that a screening test for HTLV3 antibodies should be introduced to all regional transfusion centres as soon as possible. So that was the advice that was being provided to Sir Donald Aitchison as at the 31st of December 1984. I'm going to go now back into Sir Donald Aitchison's autobiography to look at his recollection of what he made of the information that he was being given about AIDS in late 1984 and early 1985. So that's at WITN 0771088. That's the sideways front cover again. And then could we go to page 13, please? So this is the chapter of Sir Donald Aitchison's autobiography touching on the response to AIDS in the 1980s. He says in the second paragraph on the page that on his arrival in Whitehall, so that was October 1983, a handful of cases of a mysterious new disease had already occurred. It was probably more than a handful by that stage, but that's what his recollection is of what he knew. He recollects that these had not been shown to be due to an infection and their significance was uncertain. But he remembers 2 developments striking him particularly. The first in 1984 was the discovery that AIDS was due to a retrovirus and likely to prove incurable. And the second was that it could be transmitted by vaginal as well as anal intercourse. And then over on the next page, please. He says that perhaps due to wishful thinking, he did not at first grasp the full implications of this, but the defining moment was not long delayed. It occurred early in the following year and came from a different continent. And he goes on to describe that hearing about the situation at that time in Zambia and then in Uganda made him realise the severity of the situation that could unfold in the United Kingdom. And he says in the second paragraph that he was horrified and that he immediately sought an urgent appointment with his political boss, who was Lord Fowler, the Secretary of State for Health, whose reaction was one of deep concern. And for the rest of his time, Sir Donald Aitchison's time in Whitehall, he found Lord Fowler's unfailing encouragement and support enabled him to give the AIDS epidemic a place close to the top of his priorities. So he describes there, in around early 1985, coming to a personal realization as to the severity of the unfolding risk and taking steps to prioritize the issue as amongst, we've heard he had a broad and heavy workload as CMO, but it's at this point that he decides that this is a priority. And his recollection in his autobiography is consistent with the contemporaneous documents, which do show that increasing prioritization of the issue in his personal workload from early 1985 onwards, and we're going to come to some of those documents. So the first one we'll take, please, is DHSC 0000562. and this is a draft ministerial submission which Dr. Smithies sent to the CMO's private office with a covering summary. She says, CMO wished to consider this submission prepared with administrative colleagues for ministers to obtain approval in principle for the introduction of a screening test for AIDS antibodies in the National Blood Transfusion Service. And she goes on to describe the test and the necessity of scaling up the production of the reagent so that the test can be applied more widely. So there was a submission requesting approval for the introduction of universal testing in National Blood Transfusion Services. We don't have the final submission. We do know that it was sent to minister. It was endorsed by Sir Donald Aitchison, and he put it to ministers on the 15th of January 1985. And from contextual documents, it's understood that the final submission was in identical or near identical terms to Dr. Smithies' draft, which we have here. We do have the Minister of Health, Kenneth Clarke's reply to that submission, which is at DHSC 0002482 _ 012. So this is Kenneth Clarke, then Minister for Health, replying to that submission on introduction of testing. He says, thank you for your submission of 15th of January. So we have the date it was sent. This is his reply on the 22nd of January. He says, this looks inevitable, I suppose. Could I have drafts, please, of the proposed public announcement of both points? Could I also have a draft of a letter to go to all chairmen of regional health authorities explaining our proposals? Asks about Wellcome, who are developing the test. He asks whether the costs would be met from the income now going to the blood transfusion service from the charges introduced for the handling of blood products to private hospitals. And then he says, before we all panic further, it is presumably the case that the ending of the collection of blood from homosexuals greatly reduces the risk from blood collected in this country. Also, as only haemophiliacs have died, and they may have had factor VIII from American blood, is it the case that we have not had one AIDS fatality from blood donated in this country yet? Do we need this and heat treatment of the blood? So those questions went to Sir Donald Aitchison regarding his submission that testing should be introduced as well as heat treatment, which we know is underway. And his reply is at
What's the date of this?
This is the 22nd of January.
Thank you.
It's just the handwritten 22nd above the distribution list. We have the.
Can I just pick up on what's happening in the background to this? As at the 31st of December, you didn't go to that particular part of the memo from Dr. Smithies to the CMO, but I think there's a description in it of how it was proposed that Wellcome had access to Porton Down CAMR in order to scale up the production of the reagent, it being necessary to have something to test against. If you're testing something, you have to have something tested against, and you have to have enough of it if it's going to be a test around the country. I think it was anticipated that might be available in the first quarter of 1985. Now, we know that a test was not universally adopted for screening until October 1985, and the delay is a matter of importance to the inquiry to investigate as thoroughly as it might. So here we have the CMO being told that there is a widespread emergency in Africa early in 1985, may well be about this time, the profession is calling out for an urgent test, and Dr. Smithies is writing in that sort of vein to the Minister of State for Health. So it's what then happens might be a matter of some interest, as far as the CMO papers may reveal it. The CMO is lending his shoulder, is he, to getting testing done?
We'll see in his response, which is at DHSC 00023111051. Just to answer your question, Sir Brown, will come on in more detail through the documents. But he does push for the introduction of testing. We'll come to a question about the time scale for the introduction of that testing, and he agrees that the welcome development process should be followed through, and there is a period during which he is supporting submissions about making sure that the time frame is sufficient to allow for the testing to be properly developed before it is implemented in all of the regional transfusion centres. So that's a summary, but we'll come through via the documents. So this is the reply to Sir Kenneth Clarke on the 31st of January 1985, and he answers the queries raised that we just looked at. If we look under AIDS from UK, blood and blood products, he reiterates his previous advice in the submission. He says, while as Minister of State for Health suggests it is hoped that the revised leaflet will substantially reduce the risk, we cannot guarantee that all homosexuals will desist from donating blood, even with the additional publicity alerting them of the dangers. There may be considerable social pressure on the individual to continue donation. Additionally, heterosexual contacts of bisexual men and drug abusers and other risk groups may be unaware that they have been contacts with infected persons. My advice must be that in view of the fact that 2 million units of blood are used annually without a test, it will be inevitable that further transmission of the virus will take place as a result of blood transfusion. And then you'll recall he was asked specifically whether there was any case of transmission by blood transfusion in the UK. And he says, as far as it's known, there are no cases of the actual disease AIDS in the UK having arisen following blood transfusion, and that the 3 haemophiliac patients with AIDS had received imported factor VIII. He says, however, there are 3 further patients to whom the infection has been transmitted by blood donated in the UK who may yet develop the disease. And then over the page, in the second page of the document, please. Under heat treatment and screening, he says that the proposed antibody test is not infallible, but it is the best at present we can do for whole blood. Blood products are made from pools of many thousands of donations, and so the risk of contamination very much increased. He says it is believed that heat treatment will reduce this risk, and therefore until a specific test is generally available, and this will take time, he advises that heat treatment for pooled blood products will continue to be necessary and should be provided. So that's his answer to the challenge as to whether both heat treatment and screening are required. And then he further proposed at the bottom of that letter that a press release and a letter to regional health authorities should be circulated announcing that funds would be earmarked. Can we next then go to DHSC 0002327_028? So, in effect, he replies twice to Kenneth Clarke's questions, because after having sent document we just saw on the 31st of January, he follows up on the 1st of February with this communication entitled AIDS, the needs for heat treatment as well as an antibody test. And he says the Minister of State for Health asked for clarification of the need for heat treatment as well as an antibody test. As the Minister knows, blood for transfusion, once it has been tested for its blood group and for evidence of infection, is delivered straight to hospital blood banks for use. He says this is the blood which we wish, in addition to screen for AIDS antibody. Heat treatment of blood for transfusion is not possible because of the damage it would do to the cells it contains. So making the point that heat treatment is for factor products but not for whole blood. And goes on to explain pooling and fractionation to make factor VIII, which needs heat treatment, and the additional risk coming from pools. So he has replied not only once but twice to Lord Clerk to emphasise the need for the introduction of the screening tests. And we know that that advice was heeded, and Lord Clerk's provided evidence to the inquiry. He says that the process for the introduction of screening tests was a topic which closely concerned the medical advisors, and in particular the Chief Medical Officer advised on the strategy for evaluation of the tests, and his advice was accepted. And the press release and letters to regional health authorities that we saw the CMO asking to be sent were issued on the 20th of February of 1985. At around this same time in the chronology, Sir Donald Aitchison established an expert advisory group on AIDS, and it was this group, which is known by the acronym EAGA, EAGA, Expert Advisory Group on AIDS. It was their advice that he relied on in pressing that recommendation that we just saw for screening to be introduced with the Minister. I'm just going to take us back to the autobiography to see what Sir Donald Aitchison recalled about the establishment of EAGA. So that's WITN 0771088 again, please. And page 15 of the autobiography. And it's the bottom left-hand paragraph where he says, as far as HIV/AIDS was concerned, a few cases of what was already seen as a fatal virus infection associated with infected blood and sexual intercourse had already occurred prior to my appointment, and that he decided that the implications of the infection was so serious and the knowledge so limited that he needed to seek expert advice as soon as possible. The Expert Advisory Group on AIDS, EAGA, was set up, and having met 7 times in 1985 and regularly thereafter, it made a series of recommendations which led to more effective control of HIV/AIDS within the UK than in any other country that had links with the African continent, he says, with hindsight. He says that the authoritative advice of EAGA led to a secure understanding of how the retrovirus was and was not spread, which stemmed the risk of mass hysteria. In DHSS, we found ourselves dealing with a seemingly endless series of questions, not only on those points, but on worries about possible cross-infection from butchers, bakers, waiters, and ticket collectors. So that's what he says about how and why he established the EAGA. And if we go to PRSE 0002734, we can see the minutes of the first meeting on the 29th of January 1985. Now, as we've just seen in the autobiography, there were 7 meetings in 1985 and further meetings thereafter. We're not going to go to all of the minutes, but we will just look at the first meeting, and in particular what was said about the introduction of screening. So we can see there is an attendance list for this group. We can see that Dr. Abrams chaired. He was one of the Deputy Chief Medical Officers. And in further minutes, sometimes Dr. Aitchison chairs and sometimes one of the Deputy Chief Medical Officers chairs. On this occasion, he was an attendee at the top of the right-hand list. He attended for part of the meeting. At paragraph 2 on that page, we can see that Dr. Abrams thanked members for responding so quickly to the CMO's invitation to serve on the expert advisory group, and he emphasised the importance of the subject on which they were being asked to provide advice, and drew attention to the fact that papers circulated were not for publication. The meetings were private and treated in strict confidence. Could we turn to the next page, please, and look at paragraph 4? The CMO added his personal thanks, and he stressed the potentially serious epidemiological problem posed by AIDS. He noted that the terms of reference drawn up for the group were very wide. Specific issues on which advice was sought included measures necessary in the field of public health to control the spread of AIDS. Also, the Chief Medical Officer hoped for unequivocal advice from the group on the question of the introduction of a screening test into the MBTS. So for context, this meeting is on the 29th of January, so it's 2 days before the reply he sent to Sir Kenneth Clarke on the 31st that we've just looked at. So that group discussed a number of measures, but we're focusing, please, at page 4, paragraph 19, on screening in particular. The chairman reminded members that the November meeting of the BTS Advisory Group on AIDS had concluded that a screening test for all blood donors should be available as soon as possible, made available as soon as possible, and he asked whether IGA endorsed that view. And then if we go down to paragraph 20, we can see that there was general support for the introduction of a blood donor screening test as soon as practicable. So it was with the support and advice of this group on the 29th of January that Sir Donald Aitchison made his recommendation to Kenneth Clarke on the 31st of January and reiterated it in the follow-up letter we saw of the 1st of February. I'm just checking the time. I think there is time to go on a slight detour and look at 3 documents relating to the report on an inquest, which show Sir Donald Aitchison's position as at around this time. So if we could go first, please, to DHSC 0000373 and go to page 2 of that document. We can see that in April 1985, the coroner for Inner North District, Greater London, wrote to Sir Donald Aitchison describing an inquest which had been conducted into the death of a child who had died from AIDS-related pneumonia caused by a blood transfusion he had received in Washington, D.C. And the coroner wrote to the CMO stating that the case fell within the rule concerning reporting on prevention of future fatalities, so very politely and obliquely requiring Sir Donald Aitchison to reply with a report on prevention of future deaths. Sir Donald Aitchison received that letter and reviewed it, as well as an internal briefing on the case in DHSS, And can we go to page 1, back to page 1 of the document, please? And here we have a note from the CMO's office to Dr. Harris, who was one of the DCMOs, on the 17th of April 1985. And it says, I agree with everything Mr. Arthur says. I'll take you to the contextual document to make sense of that in a moment. He goes on to say that 3 people have already been infected with HTLV3 as a result of blood transfusion in the United Kingdom. Almost certainly others have, as we know, that several AIDS patients have donated blood in the months prior to diagnosis. I shall be very surprised if native cases of AIDS due to blood transfusion do not appear in the next year. So that is Sir Donald Acheson's comment in April of 1985. And just for context, when he says he agrees with everything Mr. Arthur says, could we go to DHSC 0000375, please? This is the briefing note on the death of the baby that was circulated internally in DHSS. And if we go to the next page, please. There's a summary of lines to take, and it's signed by Mr. Arthur. So these are the lines to take which Sir Donald Acheson saying he agrees with, but he added to those lines to take his belief that almost certainly others who had received donated blood from patients who had gone on to develop AIDS might go on themselves to suffer from the illness. And then to round off this episode, the report back to the coroner is at DHSC 0000372. And he replied personally. It's not from his office. It's a personal letter to the coroner in response to the request for a report. And he sets out the measures which are being taken. So at paragraph 2, or the second paragraph, he says, you'll be interested to know that we're taking active steps to try to prevent the possible transmission of the AIDS virus via blood and blood products. He says it's an advantage that blood is donated voluntarily in the UK, unlike in the United States. He goes on to describe circulating leaflets in regional blood transfusion centres for potential donors, requesting those at high risk do not donate. He says they're acting as quickly as possible to introduce a screening test. He adds, unfortunately, these tests have not been evaluated, and we have therefore asked the Public Health Laboratory Service to carry out a full evaluation before any test is approved for use. So that comes back, sir, to the issue of timing of introduction of the tests. He goes on to describe heat treatment, and in the final paragraph he says he will be sending out to all doctors in England information on AIDS and advice on how to counsel patients that either have the disease or have a positive antibody test. And he refers to the expert advisory group, EAGER, constantly reviewing the problem. The information for doctors that he there refers to was published on the 15th of May 1985, and that is at DHSC 0105232. I mentioned in the opening of this presentation that part of the function of the Chief Medical Officer was from time to time to circulate what are referred to colloquially as Dear Doctor letters and his recollection that it wasn't for him to provide direction to doctors, but they do provide what could be described as guidance. This is the first Dear Doctor letter that related to the topic of AIDS, sent on 15th of May 1985. And it's sent enclosing a paper, AIDS General Information for Doctors, which sets out information on groups at risk, presentation, diagnosis, measures taken to control the spread, and other information which includes recommendations about counselling. If we go over to the next page, please, at the sign-off of the covering letter, you can see he says, "I take the liberty of sending this information because AIDS is a new disease. The first UK case was diagnosed in 1981, about which information has not yet got into textbooks, but which has been widely discussed in the media, often in an inaccurate and misleading way. Although at the time of writing, only 159 cases have been reported, AIDS will undoubtedly become substantially more frequent in the immediate future, and cases will occur more widely throughout the country. I hope you find the information helpful." And so it might be taken from the tone of this, that it's a tone consistent with the role being to provide guidance but not direction. He's not ordering anyone or telling them what to do, but he is providing guidance and information. The enclosed paper is at page 3 of the document onwards. So it's AIDS General Information for Doctors. Could we go to page 5, please? At the bottom of page 5, you can see there's a subheading, "The Cause." So the CMO is telling doctors as of May 1985 that it now seems almost certain that the cause of AIDS is the virus, which is now known as HTLV, I think it's HTLV3, and that he will use that term. And then could we go to page 6, please? Under the first heading, he notes about halfway into that paragraph that it's important to point out that the majority of the infected individuals are asymptomatic. Unfortunately, there is at present no method of distinguishing those asymptomatic individuals who are infectious from those who are not. But he also goes on at the end of that section, just what we can see at the bottom of the page, to note that the incubation period between infection and development of AIDS is prolonged and has been found to vary from between 15 and 58 months. At page 7, please. Just at the top of the page, you can see he says that the risk of infection as a result of blood transfusion is extremely low. And he goes on to say at page 12, at the top of the page under special investigations, that an HTLV3 antibody test should become more widely available in 1985. It indicates if the result is positive and confirmed that the patient has definitely been infected with HTLV3. He reiterates that this does not imply that the patient concerned will develop AIDS, but on the basis of present knowledge, they should be regarded as being capable of transmitting the disease. So that was the state of information being circulated by the CMO to doctors widely in May 1985. The next document in our narrative is at DHSC
Just before you go do that, if you flick back to the page we were looking at before this.
So that was...
and the page before that. And again. And again. And again. That's it. It was the table which just caught my eye as we went past. The number of AIDS cases as at the 28th of February 1985. So the number which had been reported earlier in the hundreds in the States is now in the thousands, 6,293 amongst homosexual, bisexuals, 8,697 altogether. And you can see there the blood transfusion recipients, 104 in the States, 62 hemophiliacs. So that's, if you like, what's the position in the States, who may be thought to be ahead of the UK in the development of infection. Yes. So it shows the extent to which what is being considered is set against the growth of an epidemic.
Yes, and of course doctors receiving this letter and browsing through the attached leaflet would see the headline points being made, but also they're here being provided with the raw data showing the spread and the rate of the spread.
And it shows also the risk to female sexual partners, to children of affected mothers. Yes. Yes, thank you.
Thank you. Could we next go, please, to DHSC 0002269_054, please. So this is a minute dated the 31st of May 1985 from DCMO Dr. Harris. It's copied to Dr. Abrams, who's another DCMO, and Dr. Hunt. And it says resources. Sorry, I'm just looking for my reference. Do we have WITN 0771099? WITN 0771099. Yes, this is the document. Sorry, apologies, I gave the wrong reference before. So this is the 31st of May 1985 communication resources for HTLV3 antibody tests. And we can see that it says at the CMO's meeting reviewing the AIDS situation yesterday, you were able to give assurances that the financial resources needed to cover the public health laboratory services evaluation of the commercial kits has been made available. The CMO was questioned later that evening by the Parliamentary Secretary Health on the overall position, and it is quite clear that ministers need to know of the timescale for the evaluation of the test and, if satisfactory, for the introduction of the test at every transfusion centre. And it goes on to say that the director of PHLS has provided an estimate of the funds required for testing within the service and has been asked to provide a critical path analysis of the entire exercise.
Who's this from?
So this is from, if we scroll down, Dr. Harris, who is a DCMO, to Mr. Harris, who is in DHSS.
Yeah. So this suggests that the finance to cover evaluation has only just been made available.
Yes, and that discussions are ongoing at this point about evaluation of the testing kits.
So it hasn't started yet?
No, we can take that.
And this is in order to evaluate a test which it was common ground at the start of the year needed to be introduced as soon as possible.
Yes. The next document, also on this topic, is DHSC 0002311_021. And this is from Sir Donald Aitchison himself to John Patton, Parliamentary Under-Secretary for Health, on screening of blood donations for HTLV 3. And the context of this letter, it's about a recommendation which had been sent on the 7th of June by Mr. Harris, the recipient of the document we just looked at, to John Patton. And Mr. Harris had recommended that a test ought not to be selected until after that PHLS evaluation and field trials had been completed, which might take 5 months to implement. And the other option for consideration was proceeding to select a test within the next 2 months without undergoing that evaluation process. And the CMO wrote about that issue to John Patton in this document. There is a finely balanced decision here, but I am in favour of the suggested line, i.e. he agrees with taking the time to evaluate first. He says, I think, however, that we must do everything possible to ensure that PHLS is able to keep to its schedule. He says, as far as the option to introduce a partially evaluated test forthwith is concerned, I think the prospect of wasting a relatively small quantity of blood from false positive tests is not the major objection. The major problem is that scientists concerned at PHLS do not yet have confidence that the suppliers could produce testing kits which are reliable on a large scale and which would continue to be reliable on the shelf. He takes the view that it would be worse to be in the position of having to withdraw a test once introduced than to be in our present position of carefully evaluating the tests. There could also be ethical problems in refusing to tell donors who are volunteers in this country the result of a test carried out on their blood if they wish to have it. He goes on to say that ministers should recognise that support for a different view, i.e. in support of earlier introduction of testing, is likely to appear in the medical press. And he says, see Professor Bloom's letter attached. We'll go there in a minute for context. He says that considerable public pressure would develop if in the meantime a case of AIDS develops in a recipient of UK blood. Such a case or cases is likely to occur sooner or later due to infection 1 or more years prior to our warnings to people at risk not to donate blood. So he is here siding with the argument for evaluation first, but acknowledging that there may be public pressure on the other side of the argument. And I mentioned for context we'd look at the letter he enclosed. That's at DHSC 0003828_191. And you can see it's a letter in a medical journal signed by Drs. Bloom, Forbes and Ritzer, on HTLV haemophilia and blood transfusion. And if we look towards the bottom of the middle paragraph, the screen is perfect at the moment. So just at the bottom of the middle column, they say all these considerations underline the need rapidly to introduce screening for HTLV3 antibody for all blood donations. Notes that 3 commercial test kits have been approved in America by the FDA, and although there may be a small number of false positives, it's unreasonable to delay testing until this possibility is eliminated. So we know that Sir Donald Aitchison was alive to this argument, but he took a different view. His recommendation for evaluation first was accepted, and the announcement was made on the 27th of June 1985 that the screening test would be introduced once the PHLS evaluation programme had been completed. And then in that August it was announced that the screening would be introduced on the 14th of October 1985. The next place we're going to go to are 2 Dear Doctor letters to support the introduction of that screening. So the first is at NHBT 005 7007 underscore 001. So this is a letter of the 23rd of September 1985. It was the second Dear Doctor letter which Sir Donald Aitchison sent in relation to AIDS, and you can see that he's titled it HTLV3 antibody testing outside the National Blood Transfusion Service. So this letter referred to general testing facilities which he sought to raise awareness of in advance of the introduction of testing for blood donors. And he says, if we go down, please, in the bottom paragraph, that there's already evidence of widespread public interest in the introduction of the test and how it will be provided. It is important that doctors, particularly general practitioners, are fully aware of the local facilities which have been established when they are approached by patients about the need for a test. May I therefore ask you to consider how your local arrangements can be made known? And this ties in with the concern that was flagged by Dr. Smithies in her internal briefing, that an incentive might be created for people in high-risk groups to donate blood if testing facilities were to be introduced widely in regional transfusion centres first, before being widely available in sexual health clinics and otherwise in the NHS. And that was something which was a factor in the way that testing was rolled out. And Dr. Aitchison publicised first the need for awareness of general testing facilities before, shortly before the introduction of testing at transfusion centres. And then we can see he sent a further letter at WITN 077 1110. Sorry, I've taken you to the publicity rather than the letter itself. But what this sets out is that there is a press notice and a Dear Doctor letter sent out on the 1st of October regarding the introduction of testing at blood donation sites. And we can see there that to obtain maximum coverage for the letter and accompanying advice, there was a media round and he was invited on television programmes and promoted the introduction of testing for blood donors there. I'll come back then to the Dear Doctor letter at the end of the presentation when we look thematically at those as a category. I've gone slightly out of chronological order to follow through to the introduction of testing. The next theme that I'm going to address is the introduction of the public awareness campaign on AIDS and how Sir Donald Aitchison was involved in that from mid-1985 and through 1986. As that is a new topic in itself, might it be convenient to break a few minutes early for lunch so we can start fresh with the new topic after lunch?
Very well. Well, we'll take a break in that case till 2 o'clock. So 2 o'clock, and we start again on our new topic.
Thank you.